Mayo Clinic is transitioning to a single licensed hospital in Rochester. This is a natural progression in the integration process that has been going on since 1986 and will continue to recognize the relationship we've had with the Franciscan sisters for now over 130 years. We're essentially doing this for two reasons. In the reporting environment in which we live, it's critical that Mayo Clinic portray the quality of the work we're doing in state and national rankings and avoid any misrepresentation or confusion for our patients about the quality of that work. In our regulatory environment, it's critical that Mayo Clinic deliver its complex care under a single license.
The Franciscan Mission for us sisters is the spirit of St. Francis of Assisi, and that we as sisters really have always been called to serve the poor, the disadvantaged, and when there was a need, we are there. We are there, and this hospital was started because there was a need to provide health care, to have a place where the sick could come and be hospitalized and cared for by the Mayo doctors. So that really is the heart and the soul of who we are as the Franciscan mission that's going to be continuing.
Our values never change. So it's Christ healed, and that means that the patient comes first. That's what Dr. Mayo said. That's what we've practiced all these years. That will be our continuing main theme, is that the patient comes first. I would expect the mission and the values to continue, to maybe even become stronger.
You know, St. Mary's Hospital, you can take the name out of St. Mary's Hospital, but the St. Mary's will always be the same. There is that which is the St. Mary's, the hospital, the building, but it's the spirit, it's the life, it's the people. And that's going to continue, because we keep sharing with one another, by example, by presence. That's not going to change.
In doing this, we will continue to honor the values that are so essential to Mayo Clinic, the Franciscan Mission and the founders' values that have been essential to us for our entire legacy. We'll continue to display the religious artifacts at St. Mary's Hospital and Methodist Hospital, and the Eucharist will be reserved at the St. Mary's Chapel. Our relationship with the Franciscan sisters has been critical to our entire history at Mayo Clinic. And in closing, I want to thank the Sisters of St. Francis and those at Methodist Hospital who have and who continue to partner with us over many years in today's environment and going forward for future generations.